Welcome to The Explainer. Today, we're diving into a fascinating story about a heart condition that's there from birth. But this isn't just about what can go wrong. It's about the absolutely remarkable, ingenious ways the human body and modern medicine can work to make things right.
It's a pretty startling question, isn't it? Well, the answer unlocks this incredible story of anatomy, physics, and pure, raw survival instinct. And it all revolves around a condition called Tetralogy of Fallot.
So let's get right into it. The name itself, tetralogy, gives us a huge clue. Tetra, that's Greek for four, and in this case it means a very specific and very tricky combination of four defects that are all happening in the heart at the very same time.
Okay, so these four things together create, well, a perfect storm inside the heart. It all kicks off with defect number one, pulmonary stenosis. Just think of it like a major traffic jam, a bottleneck for blood trying to get to the lungs. This one problem sets off a whole chain reaction involving a big hole between the heart's chambers, the main artery being in the wrong spot, and finally, the heart muscle itself becoming dangerously thick.
But here's what's really wild. One of these flaws isn't like the others. That fourth one, the thickened muscle, it's not actually there at birth. Nope. It develops over time because the right side of the heart is just working so hard, trying to shove blood past that blockage to the lungs. It's like the heart is bulking up like a bodybuilder, but out of sheer desperate necessity.
So, to really get this, imagine you're a drop of blue, oxygen-poor blood inside that overworked right ventricle. You've got two doors in front of you. Door number one is this tiny, narrow, difficult path to the lungs. Door number two, it's a huge, wide-open hole that leads straight to the aorta, which is basically the superhighway to the rest of the body. Which one are you going to take? Yeah, the path of least resistance every single time. And that right there is the fundamental problem. Blue blood takes the easy way out and gets sent to the body.
Okay, but wait a second. This brings up a really big question. If this whole mix-up is happening from the start, why isn't the baby blue from day one? Why the delay?
Well, it turns out the body has a couple of tricks up its sleeve, at least for a little while. First, there's this amazing built-in backup plan. A tiny vessel that's crucial in the womb, called the ductus arteriosus, stays open for a bit after birth and acts like a temporary back door, a little bypass for blood to sneak into the lungs. But it's on a timer. It's going to close. And at the exact same time, that muscle causing the main blockage is getting thicker, making the traffic jam worse and worse.
So you can see where this is going. You've got the backup route closing down, just as the main route is getting even tighter. This progression leads straight to the most dramatic and dangerous moment for a child with this condition, something called a cyanotic or TET spell.
And let's be clear, we are not talking about a subtle change in color here. This is a full-blown, life-threatening medical emergency. It's a moment where the body is suddenly and profoundly starved of the oxygen it desperately needs to survive.
And you know, it's incredible how fragile this whole system is. Something as simple as crying or getting a little dehydrated can trigger a spasm in that overgrown muscle. And when it spasms, it clamps down hard, basically slamming the door to the lungs shut. All of a sudden, that difficult path becomes an impossible one. And nearly all of that blue blood has no choice but to flood through the hole and into the body. The oxygen levels just plummet.
But right here, in the middle of this absolute crisis, the story takes this amazing turn. The body, it has its own built-in first aid response. It's an instinct that these kids somehow, almost magically, discover all on their own. For years, doctors and parents noticed this really strange thing. Toddlers, in the middle of one of these terrifying spells, they would just instinctively stop and squat down. And unbelievably, it worked. The blueness would start to fade. But for the longest time, nobody really understood why.
And the physics behind this is just, it's pure genius. By squatting down, a child literally kinks the big arteries in their legs, just like kinking a garden hose. This creates a huge amount of back pressure in the main artery, the aorta. So all of a sudden, that easy exit isn't so easy anymore. That new pressure makes it harder for blood to go down to the legs and actually forces more of it to turn around and push its way through that difficult path to the lungs. They are literally rerouting their own blood flow to save their own lives. It's incredible.
This amazing natural response brought precious time. And not only that, it actually inspired the medical solutions that came later. So let's take a look at the modern doctor's toolkit. Because while squatting is a brilliant fix in a crisis, living with low oxygen long-term forces the body into other, more dangerous habits. The body senses it's not getting enough oxygen, so it panics and tells the bone marrow, make more red blood cells now.
But that just makes the blood thick, like sludge, which massively increases the risk of clots and stroke. So you can see why real medical intervention becomes absolutely essential.
So modern medicine has developed this three-pronged attack. First, for an immediate crisis, there are drugs that can help relax that spasming muscle. Then, for a temporary fix, surgeons can create something called a shunt, which is basically an artificial version of that natural bypass the baby had at birth. And then, finally, there's the total repair, where surgeons actually go in, remove the muscle that's causing the blockage, and patch the hole for good.
You know, in the end, the story of Tetralogy of Fallot is so much more than just a list of 4 heart problems. It's this powerful testament to survival. It shows us that by watching and understanding the body's own desperate, brilliant solutions, like a little kid instinctively squatting, we can actually find the path to creating medical innovations that save lives.